Well, I think in a time pre-COVID, 1 in 2 consultations I had in my surgery were about mental health. But the new landscape has meant that almost all consultations, we touch on it to some extent. But the challenge has been that mostly it's women who are open to discussing it. Men, particularly minority ethnic men, are still so hesitant to talk about their mental health. And of course, it's a really worrying trend if we consider that the leading cause of death in men under 50s is suicide. Now, men anyway, of all backgrounds, on average, are 1/3 less likely to seek medical help than women. And of course, ethnic minority men or men in marginalized communities, even less so. So, of course, with so many in denial about those health issues, it was something that really resonated with me. It was something I saw in practice, and it was something that I felt we needed to champion, we needed to take out and actually focus on and get more men engaging with their mental health.
That's great, Mo, because I was thinking that some men, as you said, may be very hesitant to talk about their mental health. And unfortunately, there is still quite a lot of stigma attached to it. Yeah. So I was wondering, what sort of message should men hear about talking about their mental health?
Well, I think one of the key things to remember is the brain is just like any other organ in the body. It needs help, it needs support, and it's so important that we remember that. I think one of the best examples I give in this regard is if I were to ask you to carry a heavy glass of water, and I said to you, well, how long could you carry it for? You'd probably say 1 or 2 minutes. Your arm would suddenly start to ache, and then you'd want to put it down. The brain is similar to the physical side. It's just that instead of putting down that mental stress, we carry it, and that aches and it causes pain, it causes hurt. And I think for many of us, we forget that. We think, sorry, my button is gone. For many of us, we forget that. We think that mental health is different to physical health, that it's something that we should be worried about, that we should be ashamed of discussing. And actually, it's nothing like that at all. For so long, men have had this concept of traditional masculinity. I'm a male, I need to provide, I need to be strong, I need to be impenetrable, I can't have any worries or concerns, I can't be seen to be getting help. That's a huge, huge misunderstanding. We all need support, all of us, even at this very moment in time, we're all suffering with some form of mental illness, some feeling of unwellness, but it's a scale. Some of us are just a little bit irritated. We got cut up in traffic or the internet wasn't working and it's something we have to get over. But sometimes it can be stronger. And on that scale, when it's really affecting our functioning, when it's causing us to feel low, when it's affecting our mood, and it's affecting our relationships in our life, that's what we want to talk about. That's what we want to say, come in and we can help you and we can support you.
Great. So could you talk us through a scenario perhaps where somebody came to your practice and the signs of mental health difficulties weren't perhaps immediately obvious, and what helped you to identify that struggle?
Yeah, it was a gentleman who came in once and he said to me, Dr. Khaki, I think I've got some niggling aches here or there. I said, okay, and we examined him and couldn't quite find anything. And then we talked about a plan and sent him home. And a few days later, in fact, he called me. So, I think this is going on. I think that's going on. And after a few weeks of this, I recognized that a lot of those aches or pains or little concerns didn't really make sense. They weren't in part of any medical cluster. They weren't something that I could put my finger on. And I thought, maybe this is his way of reaching out. Maybe this was his way of saying, I'm not well, I'm struggling, but I can't say that I'm mentally struggling. So what I'm going to do is I'm going to say I'm physically hurting. I'm going to say that I have an ache somewhere. I'm going to have these odd symptoms that I can't explain because that's my way of telling you I'm not coping at the moment. And as soon as I said to him, and it was an older gentleman, Asian male, I said to him, for this instance, we'll call him Mr. Khan. I said to him, Mr. Khan, is it possible that you're not feeling that well at home? You're not that happy in yourself at the moment? And he paused and he looked at me and he said, Do you know what, Dr. Khaki? That's exactly what's going on. I'm finding it really hard to cope. I'm finding it really hard to spend time at home and be happy. I miss someone who passed away. I miss my family. I have these terrible thoughts. And we started talking about it, and suddenly it was like a whole burden had been lifted off his shoulders. I've never seen someone who seemed so happy to talk about their mental health despite previously holding it in for so long. And I think that's the effect that this can happen. I think when we start talking about what's really on our mind and what's really going on, that feeling of being able to talk and unburden ourselves is so liberating. And I think that's something we want to talk about today.